So not long ago, I sent off my spit to 23andMe, which I don't know if anybody else has done that, but it's actually kind of a lot of spit. But you send it off, and they take your spit and they extract your DNA. And from that, they can look at your sequences and give you some information about yourself. And what I found out is that I actually have an increased sensitivity for a commonly used blood thinner called warfarin. And in January of 2010, the FDA actually updated warfarin's label to say that physicians can use the genomic variants or the sequences of patients' DNA to determine a better initial dose for a patient when it comes to this blood thinner. And so actually, recently, my great uncle went into the hospital and they gave him what's considered a normal dose of warfarin, and he reacted poorly to it. And this could be because we share the same genetic background. So what's really cool about this is that I could go into the doctor, and if they want to give me a blood thinner, I can tell them about my genetic background, and it can help them to better treat me. And this type of thing is just going to happen more and more often throughout your lifetime. It may not be through 23andMe because you may have heard about their troubles with the FDA, but it is certainly a space that will be filled. And in fact, another kind of interesting story about 23andMe, when my friend got her results back, she found out that she had a mutation in a gene called CCR5, and this mutation in this gene makes her resistant to HIV. She can't get HIV. It's actually a mutation that's commonly found in the Western European, or more commonly found in Western European background. And what's really cool about this is there's a company in the Bay Area that has taken this knowledge that we now know about this mutation in this gene, and they've coupled it with this really new technology that is just exploding in the genomics field right now. If you look in the literature right now in the genomics field, this technology is everywhere, and it's called genome editing. And what it allows is for researchers to make a specific mutation in a specific gene in live cells. And so they're taking this technology, and they're working on using it to cure people of HIV. And this is something in clinical trials. So this is really cool, because this means we will not only be able to read your DNA, but in the future we may be able to edit it for your benefit. So I've told you today about many advances in both the science and the technology that's allowing personal genomics to become a reality for you, that's allowing you to access more and more information about your genome. So what I think everyone needs to start thinking about is what they're going to say when their doctor asks, because I think they will, do you want your genome sequenced? I think that the future of personal genomics is more information, more quickly, more cheaply. So I would urge all of you to brace yourselves, because personal genomics is coming. And with it, you're going to be able to get really cool information about your traits and your ancestry, really useful information about drug sensitivities. But you also could get scary or upsetting information about whether or not you're predisposed to a disease such as breast cancer or Alzheimer's. So everybody needs to start educating themselves about what their genetics can tell them, how it can tell them, and what they want to know and when. Thank you.